Bowen family systems theory, relevant for more than a half century. This is an overview of Bowen family systems theory. So who started it? It was Dr. Murray Bowen, who worked at the Georgetown Family Center in 1975. What is it? It is called the multi-generational transmission of family problems, featuring an 8-factor theory. Why was it created? It created an objective theory for taking intuitiveness out of therapy. And how does it work? It looks at multi-generational trends in family dysfunction. And it uses an examination of the 8 concepts of family functioning to pinpoint the problem. The basic tenets of the theory, it's a way of thinking about the emotional functioning of people who belong to multi-generational, self-perpetuating systems, such as families. The nuclear family, rather than the individual, is viewed as the emotional unit to be treated. Since change in one family member creates change in the others in this emotionally interdependent system, it is possible to do some level of family therapy with only one person. The 8 interlocking concepts are embedded in the basic ideas represented by this theory. The differentiated family, members of healthy families can differentiate between their own thoughts and feelings of themselves and those of others. The opposite of differentiation is fusion. Now, the greater the fusion between individual members, the poorer the functioning. Undifferentiated family, an undifferentiated person is unable to distinguish between intellectual processes and the feeling processes he or she is experiencing. There is a conglomerate of emotional oneness, so there is a cut-off from one another in the undifferentiated family. Another one of the concepts are triangles. 2 members experience stress and bring in another family member to relieve the tension. Involve another member in the argument, and so a triangle is formed. During intense stress or escalation of the conflict, the triangle gets bigger and bring in interlocking relationships with other triangles. For example, the mom and dad have a conflict and involve one child in the triangle. In the meantime, mom also forms a triangle with her sister, who is now also involved in the argument, and as the conflict escalates, these triangles begin to interact. So triangles are the dysfunctional response to increased stress and anxiety in the family. The anxiety increases, the need for distance or closeness increases. As anxiety decreases, the need for distance or closeness decreases. Another concept is the nuclear family emotional system. The dysfunction of a partner can take a number of forms, including physical, emotional, or social dysfunction, and can include substance abuse or other acting out behaviors. The other partner is often unaware of the problem and becomes stronger as the other experiences dysfunctions. So typically you find fusion in partner relationships lead to dysfunction of a partner, can lead to couple conflict, and this is then projected to one or more of the children, and so the problem becomes a family problem. The family projection process, according to Bowen, then looks as like this. There is a distant spouse. That leads to a rejected parent who turns to children. In other words, form a triangle, especially one. The anxious attachment is then formed to them, especially to one child. It is usually the most infantile of children, and the child does not differentiate and then becomes fused to the anxious parent, and therefore you have an unhealthy triangle. The multi-generational transmission process is also one of the major concepts of Bowen. Here you have transmission of anxiety from generation to generation. So the same pattern is played out eventually in the families of the children and later in the families of their children. The dysfunctional processes and roles are transmitted from generation to generation. More anxiety focused on children, the lesser the differentiation of that children, and therefore the greater the chances that they will continue the dysfunctional family pattern in their families one day. The child most fused with the anxious parent usually has the lowest form of differentiation and therefore the highest chance of continuing the problems of the family in their later family. The emotional cutoff is another one of Bowen's concepts. So the greater the fusion in the family, the greater the emotional cutoff. It's a way of dealing with intense fusion and anxiety. There is a distance of self physically and emotionally from one another, and this becomes a way of getting away or escape. He also refers to the societal emotional process. Coping strategies for life are passed down through generations. More highly differentiated people cope better with life stresses and will transmit that functioning to their children. How families deal with social expectations is also passed down from generation to generation. The therapist working with families works with families to promote greater understanding of family as a system and therefore focuses on the family as a unit. So there's no identified patient. The family is considered the treatment unit. The goal is to decrease anxiety and to begin to understand triangulation patterns and how that exacerbate their problems. The therapist also work with the family to reduce triangulation and reduce emotional cutoff, and will use the genogram that will provide an overview of the family story over multiple generations and will help to teach healthy communication.